And this is my lesson plan for a telephone triage training course. This telephone triage training program that I'm developing is to educate registered nurses in my organization in the telephone triage process so they are better able to provide efficient, reliable, and valuable information over the phone. This course will be presented in a live form of potential real-life situations that nurses may encounter when communicating with patients via telephone or other telecommunication devices. The instructional methods utilized in this course is a combination of visual, verbal, reading and writing, and kinesthetic. This will include PowerPoint presentations, verbal explanations, and mock triage telephone calls, along with an interactive whiteboard. The students will watch an online video and perform research at home to complete the in-class assignments, thus creating an asynchronous learning environment. This instructional method is based on a flipped classroom model. The students will also use interactive mock simulations to learn the technique of telephone triage nursing with the guidance of a mentor. This course will address all domains of Bloom's taxonomy, and these are knowledge, comprehension, application, analysis, synthesis, and evaluation. The student will develop the knowledge, be able to comprehend the information, be able to apply the information, and analyze the outcome. Then they will be able to synthesize their own outcomes and perform an evaluation of them. This course is based on the current telephone triage practice, organizational protocols, and research, along with experience that are based on the American Academy of Ambulatory Care Nursing. Telehealth nursing practice scope and standards of practice have been set in place through the AACN. These standards set by the AACN reflect professional norms, practices, and expectations that the nurses are to perform. The publication can be used as a tool to advance ambulatory care professional nursing practice and patient health. It will be my responsibility as the instructor to give guided instruction to the students to follow in order for the students to complete the goals of this course. The student of this course are responsible for their own time management, completion of the assignments that have been assigned, and the purchasing of all resources needed in order to complete the course. The course content is directly related to the course objectives, as is displayed in the curriculum that will be developed. The course objectives are to define telephone triage, discuss the components of the telephone triage system, identify the skills used in the telephone triage system and the roles of these tools, identify the tools used in telephone triage and why they are critical, describe the telephone triage process, define who the primary population is that utilizes telephone triage, describe potential issues and concerns the telephone triage practice may have, identify the patient-centered goals with telephone triage calls, and perform a mock telephone triage call in class as described in the process. The time allotment allowed for in class is approximately 2.5 hours per class. The time allotment necessary to complete activities outside of this class is approximately 4 hours. There will be a total of 5 classes, all in all. Instructional material for this course include the American Academy of Ambulatory Care Scope and Standards of Practice Professional Telehealth Nursing Manual. It will also include Telephone Triage and Advice and the Telephone Triage Protocols for Nurses by Briggs. Students can prepare for this class by watching a short video that will be provided on YouTube. The video is an example of the patient populace utilizing this resource. The practice of telephone triage nursing is an invaluable resource for all levels of nurses, and they need to understand the practice prior to actually performing the deed.